Okay, so the next group of drugs that we need to discuss is niacin. All right, so niacin is in vitamin B3, becomes biologically converted or activated to niacinamide, adenine dinucleotide, or NAD. And really the only difference is there's only one niacin, of course, but the only difference is the formulation. So there's immediate, sustained, and extended release. And I'm not really going to dwell on the different formulations because I don't really think you need to know all about this, specifically because niacin is just not as popular as it used to be. The toxicities, however, or the side effects that you may encounter with some of these patients that are still on niacin depend on the formulation. Okay, and so whatever formulation you're looking at can kind of demonstrate the toxicity. Okay, we'll show you that in a minute. So how does niacin work? Well, basically it mobilizes the free fatty acids from the peripheral kind of fatty tissue to the liver. And specifically it has a profound effect on VLDL secretion. And then by that way you kind of decrease LDL production. And so you can see also catabolism of HDL, which is kind of inhibited or restricted by basically preserving the activity of the ACO-A1 protein carrier. All right. So mechanistically, it's really the only drug that can lower lipoprotein lipoxygenase, and it's really the most effective drug that can increase HDL. But it has some toxicities that are really just more of an annoyance. Every dose, like physically every dose that's administered, accompanies a warmth or flushing or burning sensation that comes from cutaneous vasodilation. And so while niacin might improve all levels of lipids, each of those individualized doses become really kind of problematic just because the patient gets flushed and red, and it's kind of unpleasant. But it is useful for patients that have these familial hypercholesterolemias or those lipemias that are kind of unresponsive to changes in the diet. Okay, and there was a little clinical trial that showed that when you combine niacin with omega-3 fatty acids, which are the main kind of fatty acids that are found in fish, you can severely reduce serum triglycerides. And so niacin is a good drug. It's kind of fallen out of favor over the years. So nausea, abdominal discomfort. Some patients that have a history of gout or hyperuricemia might be particularly sensitive, but it might actually produce these conditions in the naive patients. Some patients complain of blurred vision. There can be reversible changes in aminotransferase activity, so there can be some hepatic alterations as well. There can be some hyperglycemia manifesting as well. So niacin is really, it's kind of fallen out of favor. You can probably still see some patients, some older patients who are managed by maybe even slightly older physicians, maybe still on this drug, and it exists, but very few patients tend to be on it. It's still kind of on our step prep guides, but I don't think you're going to be encountering this drug quite as readily as some of the other drugs that we're going to talk about. Okay, so that's kind of it on niacin.